going to talk about laser hair reduction today. This is Dr. Vindhya Pai and welcome to my channel Skin Talks. Laser hair reduction is one of the most common procedures we do in our practice. It's mainly done for people who have hirsutism or some hormonal issue because of which they are having extra hair growth in unwanted areas of the body. So we normally do this procedure in smaller body areas like chin, upper lip, face. But nowadays many people are actually aware of this procedure and they are asking for a whole body hair reduction also. The laser which I use in my practice is known as the luminous duet. It has two probes, a smaller probe which is used for the smaller areas of the body like the upper lip and chin, and the bigger probe which is a vacuum assisted one, which we use it for the bigger body areas. Normally we ask them to do a treatment once in a month, around 6 to 8 treatments. A series of 6 to 8 treatments are advised. This is for a normal individual, but in case you are having a hormonal issue, then we need to undergo a few hormonal tests to see exactly what you're having, and accordingly it becomes like, you might have to do around 10 to 12 treatments. But slowly the treatments will be spaced out. Like initially if you have to do one treatment every month, slowly you might have to do one treatment every 2 months or every 3 months. And even after you do all these series of treatments, you will have to undergo touch-up treatments probably once every 4 months or 5 months. So this is what I tell to my clients. I tell them do a series of around 6 treatments and then do probably once every 2 months or 3 months, and then slowly space it out to probably twice a year, and then slowly to once a year. So what happens is the hairs become finer in texture and it becomes fewer in density. So if you had 100 hairs to begin with, you might be left with 10 hairs at the end of 6 to 8 treatments. And even after that, if you do not want hairs on that surface of the body, then you will have to undergo touch-up treatments, which will slowly start eliminating all the hairs from that given body part. So this is how we do the procedure. You do not have to epilate and comb, so which means the hairs have to remain on the surface of the body. We trim it for you, we shave the body part and then do the procedure. So for the smaller probe of the machine, we normally put a gel and then do the procedure. If it's for the bigger vacuum assisted handpiece, we do not apply the gel, we straight away use it on the body. So it's very quick and practically you can say there's absolutely no pain. So who can undergo this procedure? Everyone or anyone having healthy skin can undergo this procedure. And whoever doesn't want hairs in a given body part is an ideal candidate for this procedure. Let's talk about who is not a candidate for this procedure. So anybody having unhealthy skin, like too dry skin, sensitive skin, or some skin related condition called lupus erythematosus, all these disorders are actually contraindications for this procedure. After the procedure, patients usually have a little amount of irritation and redness, which usually subsides in probably half an hour's time. And after that, we advise them to use sunscreens and maybe an emollient like a moisturizer at night time. So this produces a good texture of their skin. It improves the quality of their skin for the next treatment. We have different lasers in our clinic for different skin types. For the fairer skin type, there's one particular laser which I use known as the diode laser, which I just spoke about. And for the little darker skin types, we use another laser called the long pulse Nd:YAG laser, which is also a wonderful laser, and it works extremely well on darker skin types without producing any burns. So typically in between the treatments, like I said, one treatment is spaced every month apart. So in between the treatments, you're advised not to epilate and wax or thread You're supposed to grow the hair, but if you're feeling uncomfortable, you could just trim it or shave it for us. But that is how we do in our clinic too. So when we how we prepare a body part is usually by trimming the area, by shaving the area. We just need the stubs, we just need the roots of the hair for the treatment. We do not need the entire hair on the surface to be there. So this was a brief review on laser hair reduction. More on this in the coming videos. See you all next week.